Should you put your anxious child on medication? This is one of the biggest questions you might face if you're a parent of an anxious child. Because the research is inconclusive about whether medication or therapy is more effective, it makes sense to try therapy first. Most parents don't want to put their children on medication. But what should happen in the therapy? Let's go through a checklist to see if your child's therapist is doing good work. Some version of cognitive behavioral therapy is what's shown to work. The therapist should provide both you and your child with education about anxiety and what cognitive behavioral therapy can do to help. The therapist should help you and your child recognize how you both respond to anxiety-provoking triggers with a cycle of avoidance and/or negative thoughts, feelings, or beliefs. The therapist should explain the role of avoidance in maintaining anxiety, help you understand the process of exposure treatment, and help your child do those things that seem scary, that they've been avoiding. The therapist should help you and your child explore and challenge your thoughts about the anxiety. The therapist should provide you with education and strategies to manage the physical symptoms of the anxiety. The therapist should help you to help your child learn to monitor their anxiety. And the therapist should work with other people involved in your child's life, if necessary, such as teachers. If you're confident that you've gotten good anxiety treatment for you and your child, and progress is not being made, it may be time to try some meds. The most prescribed medications for children with anxiety are selective serotonin reuptake inhibitors, or SSRIs. Here are some of the SSRIs typically prescribed: Prozac, Zoloft, Paxil, Luvox, Celexa, or Lexapro. A doctor may prescribe something other than an SSRI or in combination with an SSRI. If your child's doctor makes a different choice, ask why. If you decide to try medication, here's a list of some questions to help you on your first visit with your prescribing doctor. How long should it be before I see improvement? What symptoms am I monitoring for improvement? How does this medication work? Are there any side effects or interactions I should know about? What should I do if I miss a dose of this medicine? How long will my child need to be on this medicine? What will you do if there is no improvement? What is the best way for me to get in touch with you if I have a question? What should I do if my pharmacy substitutes a generic? After leaving the doctor, carefully monitor your child for any changes in their behavior. Check in regularly with your child to see how she's feeling and if there's any changes in the symptoms the medicine is targeting. Be prepared to report back to the doctor with your observations, concerns, or questions. Therapy and medication together likely will have the best results.